Welcome to Kenneth City, a friendly place to live. Kenneth City was founded in 1957 by Sidney Collin, a local developer who named the city after his son Kenneth. Kenneth City is known as a city within the city. It's located in southern Pinellas County, Florida, in between Pinellas Park and St. Petersburg. Kenneth City started as 340 acres of mostly pasture all around the land. The 58th Street was a walking trail connected to 38th Avenue North until the road was finally created. Kenneth City was integrated on April 30, 1957. On June 12, 1957, Sidney Collin took 450 populations out for dinner when Kenneth City was officially chartered. There are 7 lakes in Kenneth City. On March 11, 1958, it was Kenneth City's first election. August 1, 1958, when the new fire engine arrived. September 8, 1959, was the opening of Dixie Holland School. December 9, 1959, it was Kenneth City Plaza was formed. February 1, 1960, police department was established. And in the year 1959, Sidney Collin built Clearview Oaks. That's the nation's first condominium. Meeting the needs of the community. Analysis structure. Um, we have Kenneth City has some retail trade, accommodation and food services, manufacturing, construction, finance, insurance, transportation and warehousing, educational services, churches, and produce markets. Some issues in Kenneth City community includes limited bike lanes, need more handicap accessible parking in some business places. Some commercial or small businesses need renovation and painting job, immediate resource for indigent or low-income family within the community, and multiple store closures. Kenneth City has a total population of 5,017 in the year 2013. Races includes white, African American, Hispanic, Asian. Education attainment, high school or higher is 84.4%. Bachelor's degree or higher is 20.2%. Graduate or professional degree is 88.4%. Unemployed is 3.9%. Due to lack of employment available in the community, others find job and work with a minimum travel time of 25 minutes. Analysis of the population of the Kenneth City. Population issues include crime rate increase, water quality is below national average, ratio of physicians to patient is 1 to 1100. Kenneth City violent crime rate is 51% on a scale from 0 as the low crime to 100, and that includes murder, non-negligent, manslaughter, robbery, and aggravated assault. Comparison of health concerns in the community. We have low income, lack of health insurance, lack of employment around the community, lack of immediate resource in the community. The most prevalent community health concerns in the inadequate supply of affordable housing for low-income families related to family housing. Due to the fact that low-income housing is not available to the community of Kenneth City, income that could be used to promote health, education, and social enrichment are used instead for high cost of housing.
The community of Kenneth City has access to St. Petersburg General Hospital, Northside Hospital for emergency management. There are numerous walk-in clinics, primary care offices, and specialist offices near Kenneth City. Kenneth City also has several nursing homes and assisted living facility within it and outside its borders. Pinellas County provides medical home service, which allows residents without insurance to receive primary health services such as primary care, referral to specialists, mental health, substance abuse services, annual physicals, cancer screening, mammograms, and CT scans. Pinellas County also provides a mobile medical unit, which travels to multiple locations throughout Pinellas County. targeting the homeless population. The mobile unit provides non-emergency services free of charge at various homeless shelters, soup kitchens, and other places the homeless might gather. Healthy People 2020 objectives for this city is to increase the proportion of schools that do not sell or offer high-calorie sweetened beverages for students. Pinellas County has established a requirement to make certain that at least 80% of beverage items sold in 18 high schools are of healthy qualities. The second objective is to reduce the proportion of persons who are unable to obtain or delay in obtaining necessary medical care. 25.8% of Pinellas County aged 18 to 65 are uninsured. Pinellas County has a 1 to 1,440 patient to primary care ratio. Objective 6 is to increase the proportion of the population that completes high school education. 88.9% of Pinellas County over 25 of age are high school graduates. The environmental analysis for Kenneth City. The community of Kenneth City does not have many environmental resources, but the community is able to obtain adequate resources through Pinellas County. The Pinellas Environmental Department provides daily air quality reading, air permits for businesses, and provides environmental health effects of air pollution. The county also sets the standards for the community water supply, which the county receives from the Tampa Bay water system. The county provides water for over 900,000 residents. The water is made potable by using chlorination and polyphosphate inhibitor and has been considered safe for drinking by the government body. The community issues that can be seen in this community is environmental concern. Seen in this community is the lack of environmental information and education in this community. The community center does not provide information on proper ways to dispose pet waste, information on the benefits of minimizing fertilizer uses, and the proper disposal of waste material like motor oil. By not providing environmental education, these waste products are deposited into the surrounding community, lakes, and creeks. The community does have several hospitals, clinics, and medical centers within and around the community. However, the free and low-cost services offered by the Pinellas County are several cities away from Kenneth City. For example, the medical home service is available at offices that are at least 10 miles away from Kenneth City. If a resident does not have a way to reach this office, they are forced to go to the emergency room at a higher cost.
Public officials overseeing the government actions and public policy of Kenneth City are accessible to residents through email or by phone. This information can be found on the city's official website. City officials usually respond to emails within 48 hours. All community meetings are held at the Town Hall building that you see here. During the Town Hall meetings, the items of discussion can include workshops, public hearings, budgeting hearings, and resolutions. Community meetings are held and they are open to the public the second Wednesday of each month at 7 p.m. The budget for this community consists of government taxes and activities such as public safety, highways, streets, sanitation, culture, and recreation. The budget ending the fiscal year of 2014 did not contribute to the key element for protecting our environment by funding recycling within this community. With the community's involvement of encouraging citizens to recycle, Florida can not only increase the recycling rate, but greatly contribute to managing our solid waste problem. From an economic standpoint, recycling helps in reduction of the pollution that is caused by public waste and protects our environment for future generations. 6 problems in this community are lower levels of education, poverty, lack of affordable healthcare services, cardiovascular health awareness, diabetes awareness, and crime. The prioritization of this list is simply a ripple effect of how a citizen may develop a lifestyle consisting of each of these problems. Since the highest level of education for citizens is high school, individuals from outside of the community that hold professional degrees become more marketable for the workforce here. With lower levels of income, this contributes to the current poverty level in the city, which is at 19.6%. Without enough money for the necessities of everyday living expenses, health insurance becomes a lesser priority. A community nurse would be beneficial to the citizens by utilizing primary prevention methods and educating residents on how to make modifiable lifestyle changes to improve the city's 2 major health risks, which include cardiovascular and diabetes disease. When there is a deficiency of the basic needs to live, the stronger an individual's will to fulfill those needs become. Therefore, crime rate may increase in a community until one satisfies their lower levels. The community as a whole experiences a repetitive cycle until this chain of events is broken.
Ready? Diabetes has risen drastically in countries at all income level throughout the world, according to World Health Organization. India has the greatest number of citizens that have been diagnosed with diabetes at 40 million. In dealing with this issue, it has partnered with International Diabetes Federation to effectively monitor its citizens to prevent and control this disease. Kenneth City has incorporated Zumba fitness to help its citizens to become active. A community nurse could contribute to diabetes awareness by developing nutrition courses and aiding in exercise programs.
Increasing the citizens' knowledge of eating healthy can contribute to the awareness of diabetes and prevent the disease.